Hello, my name is Andrew. This is my signature presentation for physiology class on hyperlipidemia. So, what is hyperlipidemia? Hyperlipidemia is actually more of like an umbrella term that encompasses primarily cholesterol. And cholesterol can be broken down into three different parts. We have our LDL, low density lipoproteins, your HDLs, your high density lipoproteins, and then triglycerides, which is three different types of glycerides that make up fatty acids, essentially. Hyperlipidemia, hyper meaning excess, and then lipid, fats, and then emia in blood. So hyperlipidemia translates to excess lipids in your blood. It is fair to note that hyperlipidemia in some cases may correlate with dyslipidemia, which is abnormal lipid levels in blood. It all just depends on like if your LDLs are super high and your triglycerides are super low, or you have really high triglycerides and high LDLs, or maybe you have high across the board. Regardless, just different abnormal levels. I do have a little chart over here that we'll reference later as well, uh, that signifies your what is an optimal level and what are concerning levels and what's considered high levels, which is what would categorize it as a hyperlipidemia. So, what does hyperlipidemia affect? Well, this process will primarily affect our cardiovascular anatomy. So all of our blood vessels, the highway system of our body. Uh, and essentially, this can lead to also effects that lead to your heart, and it can cause other problems in the body that'll affect like your liver, your kidneys. But those are like byproducts of its effects on the cardiovascular system. It also can affect our liver depending on uh, how we acquire hyperlipidemia. You get like inherited hyperlipidemia, or in some cases, you can acquire it through disease processes or medications, uh, and that'll affect our liver. And in other cases, a little less known, it would affect our pancreas, uh, mostly just irritating it. So the lipids in our blood uh, are primarily created through our liver, and our liver is what uh, regulates our body cholesterol levels. And it makes pretty much all the cholesterol we will ever need. So, like when we consume cholesterol, our body doesn't really take that cholesterol unless it like somehow absolutely needs it due to some disease process or again medications that are influencing our body's metabolism. Uh, but our LDLs that we mentioned earlier are low density lipoproteins. These are marked as our like the bad guys. These are the ones that primarily are the ones that are going to cause hyperlipidemia and all those issues in our cardiovascular system. And essentially they're like, for lack of a better term, they're like the sticky transport, and sticky not in a good way. So as it like travels through your bloodstream to transfer and deliver lipids, those lipids aren't really like really held on to this protein very well, and they'll kind of like leave it along the side. They kind of like litter the highway essentially with lipids as they go through the cardiovascular system. And then our high density lipoproteins, they're also lipid transports, but unlike the low density, the way that they're formed are a little more compact, and they have they're sticky in the opposite sense that they'll kind of like scrape up and pick up lipids along the way during their travels through the cardiovascular system. And then we have a bunch of triglycerides that also kind of flow through our body, uh, separate from our HDL and LDLs, but they're kind of thrown in there because they're important for uh, cell function. So our pathophysiology, so like when things kind of go awry, whether it's we're getting too much accumulation of cells or of lipid cells in our bloodstream, or lack there, well, in this case, too much. It can this can happen in a variety of ways. We'll kind of go over this briefly. So we have like your genetic types, the type that people inherit, and there's four types. Each type uh, is affected in how either the lipid cell receptors are, or how the enzymes that create the proteins are. And they're either going to affect our LDLs or our triglycerides. And all those levels will create that imbalances in what we see as what I've mentioned earlier as affecting our cardiovascular system, or liver, or our pancreas. Before I talk more about that, there's also uh, acquired hyperlipidemia, and this is coming from different disease processes such as diabetes mellitus, or from medications that can affect our cardiovascular system, our thyroid, or our kidneys. Uh, how this affects our body is when we have too many lipids and our high density lipoproteins are vast and they're depositing all these fat molecules in uh, our cardiovascular system, it's going to, over a long period of time, it doesn't just happen overnight, will develop into something called atherosclerosis, which just translates to plaque buildup in our blood vessel walls. And this can lead to heart attacks. It could also lead to kidney damage due to the occlusion of the blood vessels and possibly higher blood pressure, because when you're narrowing those vessel walls, it's going to increase the amount of pressure that's being shot into the kidneys. And then, as I mentioned earlier, how it can affect our liver. Our liver is the primary like creator, the source of our cholesterol. If there are if there are issues with the receptor proteins that inhibit our negative feedback loops or positive feedback loops in that system, it'll lead to steatosis, which is a fatty liver disease. There's just so much fat in the liver. Uh, and then when people have poor diets, which results in extremely high triglyceride levels. This can inflame our pancreas, which is also responsible for breaking down what we consume. Uh, and how do we figure all this out? Well, we typically diagnose this with blood test, simple blood test testing our lipid profile that I mentioned earlier. But to refresh, your LDL, what's considered uh, hyperlipidemic, would be above 159 milligrams per deciliter. And if you have an HDL level that's below 40 milligrams, remember that HDL is kind of like what we want. It's going to help scrape out the uh, the plaque in our blood vessels. And then triglycerides, as long as they're greater than 199, that's considered normal, but we also don't want that to go above like 300, 400. I forgot to put that on there. Other ways to diagnose this is through actual symptoms. One of them being xanthelasma. Fatty deposits build up around our eyes. You'll see in a person's eyes yellow plaque build up, like actual yellow plaque build up. It's pretty gnarly looking. I didn't want to show you guys because it's pretty gnarly, but you can imagine fat deposits around your eyeballs coming out of those tear ducts. And then steatosis, you can't see it, but a fatty liver, we would see this through like a CT or an MRI. And how we would treat this is through lifestyle changes. That's the first and foremost thing is lifestyle changes, changing how you eat, changing your diet, and exercise. Those two things are musts. And then for those who have chronic or genetic inherited hyperlipidemia, statins are the tried and true method to help keep those levels down, although they do have some drawbacks. As long as you couple those in with your lifestyle changes, diet, and good exercise, we should be able to keep those down. So who should be like who does hyperlipidemia affect the most? Uh, it's going to affect people who smoke the most. It's going to affect people with diabetes mellitus, people with heart disease, and the common thing that all three of these people have is that uh, their cardiovascular system is greatly affected. We've seen that with smokers, tissue perfusion and the hardening of your blood vessels is a predominant. In diabetes mellitus, it's you you get the same thing, but also there's insulin sensitivity, less tissue perfusion. Again, there's also neuropathy happening. Heart disease kind of goes along the line with what we've been saying earlier. It could either be genetic or lots of plaque buildup. And then, of course, family history or genetics. If you have this in your family, you should be getting tested to manage and monitor those cholesterol levels. Use of AI. Overall, I was looking for if there was like a specific AI model in hyperlipidemia, and there wasn't to my knowledge. But AI is still being used in a general sense to help those with hyperlipidemia. And this is being used in the way to either improve communication between the patient and provider, because sometimes there's miscommunication that happens or lack thereof. There's going to be improved patient comprehension of clinical data so that the patient can understand what's happening. Uh, AI is also being used to optimize patient treatment uh, and helping mitigate the undesired effects. I mentioned before statins kind of have like unfavorable outcomes, but uh, AI is going to be able to kind of like go over and optimize maybe dosages, how much, or how it can complement it with a different type of pharmaceutical to improve patient outcomes. It's also being used to discover more options. Currently scanning through the massive catalog of FDA pharmaceuticals, uh, hopefully being able to find like overlooked medications that may have side effects that actually might be beneficial, but that's still kind of in the works. Uh, Thank you, and hope you learned a little bit about hyperlipidemia.